Okay, guys, we're live.
We'll start admitting participants.
Just one second. Yeah, Chirag, your message is perfect. You can send that on this thing,
I'll send it
on your group.
on the forums too, or you'll send it on the forums.
We'll send it on the forums. You can send it on your group.
अनुषा
Yeah.
शयान said that वो ग्रुप पे ही भेजो, फिर से forums पे मत भेजो.
ठीक है, works.
एक मिनट रह रहा है. Should I send it across?
Nee, I have the message. With the link, right?
हाँ, with the link.
Yeah, Chirag send.
अच्छा हाँ, चिराग आप ही send करो. चलेगा.
And send.
Hey guys, so I'm Anusha, and thanks for joining in. We'll be starting in like a couple of minutes, basically 5 minutes. So just a few more minutes of waiting.
So like you can see screen thing. Ashwin, is it visible, right?
Yes.
Yes, you.
So you can see the red ribbon. So we all know that red ribbon stands for awareness. Like there are many different colored ribbons for different type of diseases. Most of them cancers. So can anybody like in the you can type your answer in the chat box. It's all right.
Yug, I'm sorry to disturb. Could you just speak louder because the voice is kind of low?
Okay. Yeah. Now I'm audible.
Is it possible you could increase the input if possible?
I'll just try to share. So like you can see it's red ribbon.
Can you swap the device that you're using for audio?
Or
I think you're using two devices, right?
or maybe
We
the
still can't hear
headphones.
you.
Yeah, the headphones mic isn't really picking up his voice. If you can just remove the headphones and directly talk into the phone's mic, that would, I guess, help.
Hello, so am I audible now?
Yes,
Yes,
perfect.
perfect.
Loud and
Yes, perfect.
Okay, sorry for that. So, as you can see that the red ribbon here is for AIDS. So, if you can, if I know a lot of guys know a lot of about a lot of things. So, you know there are different colored ribbons for different color of different diseases. So, like for the most common example, red is for AIDS, and then you have pink for. Can you type out in the chat box what does the pink ribbon stand for? Yes, breast cancer. Somebody answered, Urvashi. Yes, that's correct. And there are many different colored. Then there's one, I think, teal colored. So what's the teal colored ribbon for? Because these are very famous, like very common diseases for which awareness has been going on, being shared around the world a lot. The teal colored, it's like circular teal colored ribbon. Mm, right, you're right, it's ovarian cancer. And I think there are more than 25 such different colored ribbons for different diseases. And, can you mute your mic? Thank you. I think pink color is for ovarian cancer, then cervical cancer is a different color. I don't remember one now, but so that's the thing, that ribbons are for different awareness sessions around. And when I've seen the pink colored ribbons in breast cancer awareness walks and sessions, etc., where people stand to spread awareness about it. And if AIDS on campaigns happen, they happen where the volunteers and the participants, where the volunteers try to wear red ribbons on their clothes, so that as to signify that is spreading awareness for AIDS. And it's all very interesting that different diseases have different ways of spreading awareness to different colors, etc. So Ashwin, whenever you wanna start.
We have around 30, 3 to 4 minutes, and let's start. Uh, so let's start in like 3 to 4 minutes because people are still joining in, so the buffer time.
Talked about where people wear the ribbons on their clothes. This is an example of it, just showing. Yeah.
So before we start, let's start with an introduction. And so basically, I am a second year medical student, and I'm from GMA Sola, whereas Yug, here, who's the other person who I'm co-organizing with, is from NHL, and he both of us are from Ahmedabad, and he's a third year medical student. So basically, we from Rotaract Club of Caduceus, under the project Yield, have collaborated with Ghandhinagar Pride. Basically, the founder is also there with us, Rahul, and he'll also be telling us about his organization. So, Rahul, can you please elaborate on
Yeah, sure. Uh, Hello, everyone. My name is Rahul, and I represent Gandhinagar Pride. So it's an organization not registered, but it was formed out of necessity to provide a safe space to the queer community in Gandhinagar. There was no such social group for the LGBTQIA plus community. And with that, we came up with our very first LGBTQ Pride March in February 2020. And after that, we have been organizing a multitude of events to sensitize people, to raise awareness about the LGBTQ issues and other issues which are considered taboo in the society. So, yeah, thank you.
Thank you, Rahul. So basically, this is going to be a short awareness I and conducting. And Rahul will also be speaking about from the LGBT point of view, and some we'll be having some of myth busting points. So with that, we can start. And before in case if you have any doubts in the middle, just put it in the chat box. We'll be taking it at the end of the session. Basically, we'll be having 15 to 20 minutes in the end. So with that, let's start. Right. So you can have the next slide. Be talking about what an HIV and AIDS is. Basically, HIV is a virus, right? Human immunodeficiency virus. So that causes AIDS. Now, just because you have HIV does not mean you are in the suffering AIDS. Basically, there's a window period once you get affected by HIV. There's a average of 5 to 30 years, but on an average, it's 10 years of window period. And this has been the biggest threat for kids. Can I have the next slide? So basically, I have divided it into 5 main topics with minor subtopics as well. So basically, there is the mode of transmission, there's types, basically the WHO classification, and treatment and effects, and there's disinfection and prevention. And after this, we are gonna have a bit of myth busting, and it's gonna be fun, trust me. So with that, let's start with mode of transmission. Can I have the next slide, please, Yug? So basically, the most common is the sexual route, right? And heterosexual route is the commonest, and the risk is actually very less when compared to the rest of the ways in which it is done. Mainly, it is anal intercourse that has higher risk because the skin around the anus tends to tear during sexual contact and gives the virus to attach and multiply there, and eventually leading to the spreading of the virus. The second main thing is blood transfusion and needle injury. This comes under healthcare professionals because they play with needles, not in literal sense, but they are the most commonly affected by these, and basically the blood donors. And coming to the third main, that is basically vertical transmission, basically from mom to the fetus. And there's a lot of myth, like, if in case of a woman is HIV positive, you cannot have babies, right? So this is basically false. We'll be talking about this in the myth busting part. So with that, let me also say that the virus is usually seen in bodily fluids like blood, genital secretion, and CSF. In the rest of the places, this the viral load is very less, meaning that the virus is actually not seen, so it does not spread. It's not a point of transmission. So with that, let me talk about the type of classification. Before that, let me tell you that there are three factors, right? So one is the viral, environmental, and host factors. Not going to much details because it has no use for us at this moment. So basically, WHO classification, basically it has divided into four stages, right? So basically, stage one, which is asymptomatic HIV and lymphadenopathy. Stage two, where there's weight loss, recurrent respiratory tract infection. Now, basically, when I say weight loss, there is minor weight loss and there's a heavy weight loss. Minor being less than 10, which is the stage 2, whereas stage 3 and stage 4 comes under greater than 10. Now it also has reactivation of latent virus, basically a virus that gets infected, but the effect is shown after a period of time. For example, herpes zoster, it comes around when you're in childhood, and then takes period of time to have its activation to form shingles in the future, right, as an adult. Now, when we come to stage 3, it's basically more weight loss, saying as it is greater than 10. And there is chronic diarrhea, persistent fever, pulmonary TB, bacterial infection, and unexplained anemia. Basically, anemia meaning, decrease of RBC count. Next, stage 4, as I said, there's weight loss, which is more than 10. And here it's called as a disease, slim disease or wasting. Now, there is also, just because your immune is very less, what happens is there's all those microorganisms, which is very, finds it needs a chance, and these people are like group of them are called opportunistic infection, so they attack the body when they're weak. And now we are coming to the tests done in hospital, which Yug is going to explain. So
Yes. So as Ashwin explained, manifestations about a lot of different ways. And I think a lot of you must have studied HIV in whichever year you are. So you know that a lot of infections can occur, and many of those infections are just of HIV. So in those cases, you actually need to be tested for HIV. For the patients needs to be done. If you guys are actually listening, can you just give me an example of some diseases which can be seen in stage 3 and stage 4 of the HIV, like which are very commonly seen around in HIV infection. When a person is already in immune deficient condition like HIV, different types of pneumonia or something like that, which is very that to HIV. Specific to HIV, indicating to HIV infection. You can write down in the chat box. Like, no, you can directly write out in the chat box. If you, okay, P0AC, I can see that. Yes, pneumocystis jirovecii, pneumonia. Then you have a lot of other diseases. Yes, HIV wasting syndrome as it's written here. Anyone else? Any other disease? So this is indicated level of okay, HPV, right? And any other, some of PGRS is like very that of HIV. It's very specific of HIV. That type of pneumonia usually occurs in HIV. The Tithi saying cytomegalovirus, yeah, right. CMV retinitis is very common in HIV and occurs at a specific CD4. Kaposis sarcoma, the very specific answer of specific to HIV, indicating that the person is immunocompromised because of HIV, right? So thank you so much. So when you get any of these diseases, the doctor automatically goes out and suggests that this person might be having even oral candidiasis, for example. It's very early manifestation of HIV. Yes, pneumocystis, right? So these are at those times you need to get tested. Like a lot of people get those infections after the window period and everything, and at that time you need to get tested, even if you have been detected late, or before that you need to get screened for HIV. So as a lot of you who have studied microbiology know, ELISA is the best test, which is and the most commonly used test right now. ELISA, enzyme-linked immunosorbent assay, as everyone knows, it's very common these days. It has a very high accuracy currently, and it's the most commonly used test for screening. And suppose, so for example, when you donate blood, as Ashwin said, that heterosexual route is the commonest currently, but why? But it's not the highest risk. The highest risk lies from blood transfusion. Blood transfusion may, because blood is the most potent source for transmission of HIV infection, and when blood donation and blood transfusion is done, that is the highest risk. But currently, ELISA is done for every bag of blood donated. For as HIV HIV test for ELISA, ELISA test for HIV is done on every blood bag that is donated, so that as to prevent HIV transmission, and that has reduced the risk of blood HIV caused from blood transfusion severely. So that is why it's not the most common route right now, and you don't need to worry about it because all the hospitals follow that protocol. So ELISA detects that, and then you have Western blot as a secondary test. In case the ELISA gives a indeterminate test, so ELISA mostly gives a positive or negative test, but if you're indeterminate or if you're not sure, you can go for Western blot test. I think there are various other tests. If anyone can answer in the chat box, like 3-4 other tests you might have studied in micro and or you might have even seen those strips and etc. of those tests. If anyone wants to answer about it, yeah, right. HIV has this enzyme reverse transcriptase, right? So RT-PCR is also one of the other tests, like the viral RNM, RT-PCR done in COVID. Then you also have one test called immunoassay. Antigen test, yes, there's also a rapid antigen test. Viral RNA detection, right? And also there's HIV DNA PCR test, which is, we have not written that just because it gives a lot of complication, but just for knowledge, I think a lot of people already know about all the tests caused by HIV, and it's very common question asked in university exams, etc. So HIV DNA PCR, and for detection of HIV in newborns, in newborns and in pregnant mothers. I think for children it's HIV DNA PCR used in children. Otherwise, for all adults, ELISA is the test commonly used. Then now talking about the consent. So whenever you go for getting checked for HIV, the doctor will always ask your consent. The patients or whoever is getting screened for that blood test, which is related to AIDS, for checking with ELISA, and they will also discuss with the partner. So whenever if it gets positive, if your result is positive, it's necessary that the doctor also discusses with the partner after proper counseling to the patient and to the person who's detected with HIV, since the sexual contact with the partner may have already caused HIV in that person. And then the third part is the prevention of community transmission matters more than single person's privacy. As a doctor, we are supposed to respect the privacy of and be confidential to the results of the test of HIV. But since we know that HIV spreads through sexual route, and if we keep confidentiality and privacy, then HIV can spread to all the sexual partners that person might have. So that is why we need to inform all the partners and get them tested and give them drugs if they are detected positive, so as to prevent community transmission, because we all know that HIV is has no proper cure at this point. It can lead to death at some point or other in life, even if we prolong the life through drugs. Now, I'm going to talk about next I'm going to talk about the pre-exposure prophylaxis. Yes. So we all know that prophylaxis is something we give in advance so as to prevent. We don't know if the disease is there or not. So if at that need to give pre-exposure, that is when you are not exposed to the virus, but you are not in contact with any mode of transmission, but still you need to be given the prophylaxis or the drugs that can decrease the viral load or stop the disease from manifesting. even as you have a very high risk of getting a contact. All right. So for pre-exposure prophylaxis, there is a drug called tenofovir, very common drug, 300 milligram daily regimen, combined with emtricitabine, which is 200 milligram daily. Now this is a drug regimen which is prescribed. Now, all right, you don't need to remember the drugs, but what we need to remember is that which are the key risk groups which need to get pre-exposure prophylaxis uh, suitably if they can get it. So it's men who have sex with men because it transfers. It can in men the highest route of transfer is men who have sex with men, and for females it's the heterosexual route. And for workers, also for injection drug users, since injecting the same needle of HIV positive person to you can cause HIV. Then you have transgender people and also have the uninfected pattern of a heterosexual serodiscordant couple. So that means these are the people who have a very high risk of transmission of HIV through these spaces. So it's very important for them to get a pre-exposure prophylaxis if needed, if they fear might have it. All right, or in high risk groups, like also in surgeons who are working on patients who are HIV positive. All right, so if you know that the patient you're going to operate is a HIV positive patient, so in those cases, the surgeons, the nursing staff, and everyone, and all the healthcare workers involved are given pre-exposure prophylaxis so as to prevent themselves from getting HIV in those cases, which I know from hospitals and in what happens in the hospitals and clinics. So because some of us might become surgeons or might go to clinics, and this is what I've seen. Uh, I'm going to talk about post-exposure prophylaxis. So post-exposure prophylaxis is after if you have come in contact with an HIV positive fluid. It can be uh, blood or CSF or even seminal semen or any vaginal fluid or something. So in those cases, if you come in contact with that, even minute amounts can transfer HIV. So, and if you know that the status of the person, that person is HIV positive, then you need to get post-exposure prophylaxis. So for that, this is the drug regimen. You don't need to remember that because it's already comes in a it already comes in a fixed drug packet, and we just the hospitals and the clinics already provide that. So it's of the drugs, you don't need to remember them. Only if you're studying pharma can need to remember them for the exam. So can anyone give me example of like to what can be the different body fluids through which HIV can be transmitted, and if you get in contact with those body fluids, you need to get uh, given. Yes, semen is a very important thing. Blood is the most common and the highest risk body fluid which can transmit HIV from person to person. So blood is the most important, semen definitely. And turns out surprisingly that and saliva, two of the body fluids that do not that have almost zero or nil chance of transferring infection, which is a very unique thing, because when I talk about body in a blood, so when I talk about body fluids, that we think that urine and saliva are also body fluids and they can also transfer HIV, but it's not true. So as urine, it's proven that yes, CSF can also transmit HIV, but not urine and saliva. So very common thing that people think that urine and saliva. Tears may it's also very negligible, I think, uh, or it's but it's not a high risk as blood, semen, and CSF. So yes, just urine and saliva have zero transmission, I think mostly. So you want infection, which Ashwin will take over now.
So this is gonna be easy. So in a way, when I say this, in a position where you blood is split. So what are you gonna do, right? So basically, when you are in a house, you could use the household bleach, which is 10%, and use it for 10 minutes. Now, when I say there is no body contact, I mean you should not be applying it in any surface of your body because it could burn that area. And basically, when you use bleach, it's gonna be non-living things. So basically, wood, table, whatever other than what you are. Right now, the other things are ethanol 50%, Lysol 0.5%, which is going to be 10 minutes. You just have to apply it for 10 minutes, and heating, which is going to be 56 degrees Celsius for 10 minutes again. So those are 4 ways in which you could disinfect in case if you see a blood spill of person. Can I have the next slide, please? So prevention, basically, the main way in which you could get prevented is getting tested regularly every 3 months or every 6 months. Keep yourself a timeline in which you can get tested, right? And use of barriers, basically condoms, if you are having coitus, or through anal sex. So anything that involves the sexual route, you could use condoms. And dental dams in case if you're having oral sex. And basically no sharing of needles, basically people who are into high funds, basically, so those people try to reduce needles, don't in case if you're using, just use a separate new one. And also, if you're tested positive, in the person, inform and take drugs. Basically by drugs I mean medicine, which Yug has already talked about, pre and post prophylaxis. So in case if you're tested positive, just inform people, because it's not just about you, it's about people around you as well. And also there's a national helpline number which the NAPCO has said, basically to call the 24 into 7, and they'll help you, in clearing your doubt. So with that, I'm done with my part, and Rahul will be taking over, and he'll be talking about the LGBT community and summit. So
Hi again. Thank you so much, Ashwin and Yug. Well, I'll be talking about the HIV/AIDS scenario among the LGBTQIA plus community. To start with, I would say this virus is HIV is non-discriminated. So it doesn't matter if you are from the LGBT community or from the heterosexual community. Doesn't matter if you are rich or poor or from India or abroad. It's non-discriminated. So everyone has to take equal precautions. Well, to start with, of course, use condoms. We have been talking about barriers, condoms again and again, because condoms are one of the most effective and cheapest ways to prevent HIV transmission. Dental dams are there. Then get tested regularly. Um, doesn't matter if you are sexually active or not. If you're sexually active, do get yourself tested very frequently, say 3 to 6 months every year, every 3 to 6 months. And if you're not sexually active, then maybe at least once in a year. One partner or more partner. Okay, so we are no one to judge anyone, or we are no one to say that you should have a single partner, you shouldn't have multiple partners. That's totally up to you. But of course, if you're having sex with multiple partners, the risk of HIV transmission is very, very high. So that you need to take into consideration. For example, many people are also up for group sex. So in that case, you have to make sure that you change condoms every time. You shouldn't use the same condom with different people, with multiple partners. So these are little small things which you need to take into consideration. Do not share needles. Yeah. Okay, so as Ashwin already said that there are people who are interested in hyphen or chem sex, CHEM sex. Well, there are two things I would like to say. Of course, when they are having hyphen, so they'll inject something into their body. So first of all, it's not suggested to do that. But even if you are trying to do that, please do not share the same needle. Second thing is, what happens is when you take such drugs, such things, they numb your body, or at least some part of your body. They numb your senses, so you would never know what the person is doing to you. You would never know if the person is wearing a condom or not, and that's very, very risky. So of course, it's suggested that never to go for hyper or chemsex, and even if you're doing that, please do not share the needle. Let your partner know. Yeah. So if you find out that you are HIV positive, please tell your partner, all partners, if you're having multiple partners, and get your treatment as soon as possible. Get start with the treatment. Also, if you're approaching someone for just a random hookup or a casual sex, make sure that you tell your HIV status to that person, because it's not just limited to you. It's about the people you are interacting with and you are getting intimate with. So please make sure that if you're HIV positive, get your treatment started as soon as possible and let your partner or multiple partners know. Okay, so now this is my very favorite part, Mythbusters. Um, let's start one by one. So HIV is a death sentence? No, not at all. It used to be like many years ago when we didn't have proper treatment. But now medical science has advanced so much that we have a proper treatment for this. Of course, it's not curable yet, but it's treatable. There is this therapy ART, and this reduces the this viral load to an extent that it's undetectable. So the person who is HIV positive, who is undergoing proper medication, can actually live a very normal and healthy life. So first one is out. Yes, it's not a death sentence.
One,
Yeah.
Rahul, I had one thing to add on this. That actually we had I read this article that an Indian guy in UK he actually cured HIV in 2 patients
Okay.
this last year only. So they are finding new cures and there is a possibility. So that guy is completely recovered from HIV and he has no viral load. So there are possibilities, and I think that soon we can get a cure, and it's a very big race already. So I think
Yeah.
that totally prevention.
Absolutely. Fingers crossed. I mean, we all want this to be coming under the category of curable thing, So yeah, let's hope for the best. Second is you can tell if someone has HIV, AIDS, or no, not at all. I mean, of course, you can look at the symptoms, but then specifically for HIV, the symptoms are like, if I talk about in the initial phases, it might be as common as fever or fatigue. So बुखार तो आपको कभी भी हो जाता है climate change की वजह से भी. If you're stressed out, you might have fatigue. So you can't really tell if the person has HIV or not. But of course, things become complicated when it leads to AIDS. Third is straight people don't have to worry about HIV. Oh, no, not at all. As I already said, it's non-discriminative in nature. So everyone has to worry about. We shouldn't be scared of it, but then at the same time, we shouldn't take it very casually. Of course, in straight people, the chances, the rates is small as compared to the homosexual people, or specifically if I say men who have sex with men, because the chances of transmission, HIV transmission through anal sex is very high as compared to the vaginal sex. But again, we have to be, we all of us have to take the prevention. Next slide, please. Fourth is HIV positive people can't safely have children. Well, no. As I said, that there is always this therapy, ART. Okay, let's consider two scenarios. First one is that the mother, if the lady is pregnant and the lady is HIV positive, so there are very chances that the transmission can take place from mother to child. Now, if in that case the mother has to go through this entire medication and during her pregnancy and after the delivery, and in fact the child also had to go through the same for a couple of weeks, and just to make sure that the transmission is not there and the transmission rate is reduced as low as 1%. The second scenario would be if the lady wants to conceive a child with the man and the man is HIV positive. In that case, also the man has to go through this, has to take this entire treatment. And this, as I said, that ART reduces the chances, and if the viral load is beyond the detectable limit, then the rate of transmission or the probability of transmission is very less. Does HIV always leads to AIDS? No. So HIV is a virus infection, right? And AIDS is I would say AIDS, HIV is the cause of AIDS, but that necessarily doesn't mean that all those people who are HIV positive would develop AIDS, right? So again, this is not true. Sixth is with all the modern treatments, HIV is no big deal. No, again, it's treatable but not curable, and it's always said prevention is better than cure. So it's always good to take precautions. And also another thing is you never know because everybody's morphology is different. So you never know how this particular virus is going to affect a particular person. In many cases, this might lead to some serious complications and ultimately to death. So no matter how advanced the technology is, but still, we are finding the solution to cure it. So yeah, we need to take precautions. Seventh is if I take PrEP, I don't need to use a condom. Well, people do that because they don't want to use, first of all, because they don't want to use condom with their partner. Second, because they want to make sure that they don't have HIV transmission. So PrEP is effective for preventing the HIV transmission, but there is whole lot of class of STI, sexually transmitted infections out there, and PrEP is not equally effective for those. So condom, as I said, one of the most effective ways because it not only makes sure that there is no transmission of HIV, but also of other STIs. So even if you're on PrEP, do use condom. Another thing which I would like to mention here is like people have many misconceptions that condom is like 97-90% effective. So what if we do dual condoms, double condom? No, it won't lead to anything. In fact, there can be consequences because when you're having sex, so it might lead to some friction between the rubber, and this might lead to the rupture of condom. So please don't do this that you're using two condoms to make sure that it's 100% safe. No, it doesn't work like that. Also, another thing which I would say is please don't use a saliva. Thuk mat lagao bhai. There are a couple of really nice lubricants out there in the market. Please use them. And if I am not wrong, there are some oil based and some water based. So please use lubricants. Don't use your Vaseline or something. No, they won't help you out. Next is those who test negative for HIV can have unprotected sex. Not at all. No. See, when you are tested negative, that first of all, that doesn't mean that you are safe for lifelong. Okay. Second thing is, if you are getting tested within that time frame, say 2 months or 3 months, the test maybe before that, the test might not give you the true result, you know, and that is why it is always suggested if you are sexually active, then you should get tested regularly after 3 to 6 months to make sure that you are safe from HIV virus. So please never ever think about having unprotected sex. And finally, if both partners have HIV, there is no reason for a condom. Well, that is not necessarily true because, okay, so if both the partners are HIV, even if one of the partners is HIV, of course, the person is going through the treatment, right? The treatment is for HIV, for bringing down the viral load. Now, if you're not using condoms, then again, of course, you are increasing the risk of HIV transmission, right? Or making the serious situation even more complex. Second thing is, if both the partners who are having HIV and are not using condoms, then there's another category. If I'm not wrong, they are called um, specific or special. I'm not sure what's the name. These actually things can make the situations even more complex. So the bottom line is, please always use protection, and the protection is, of course, one of the most effective is condoms. And people say another important thing which I would like to mention is people say that okay, we can wear condoms when we are about to have orgasm. On that note, I remember one of the dialogues from the movie Lipstick Under My Burqa when the doctor asked the lady, like, why does your husband doesn't wear condom? Then the like, जज्बात में बह जाते हैं, नहीं बहना नहीं है, health पहले है. So please be safe, take precautions, and have a healthy and enjoyable sex life. Thank you so much.
Thank you, Rahul. Thank you so much for explaining. And so with that, we come to the end of the session. So before we, put the post-event form, and we taken the question and answer session, can I have can everyone turn on the video so we could just click a photo and post it in each of our accounts. So guys, could you just turn on your video cams?
If you could unshare your stop sharing your
All right, all right.
PPT.
Yug, could you do that? So guys, could you just unmute, like start the video basically. Yep. So thanks for joining in. So let me just share the post event form, and we'll be taking up the question and answer session. So
Okay, so there are some questions in the chat box, I guess.
So I have put the post event form, and for the first question, I'll just take the first question because it was from my part. What is the difference between HIV and AIDS? Right. So HIV is a virus. So just because you have HIV, because you are infected by HIV, does not mean you have AIDS, right? So AIDS is basically a syndrome. Basically, the S in the AIDS stand for syndrome. So it's a it's that window period. Once you get infected by HIV, there's going to be a window period of 10 years on an average, and then once you get the symptoms, once the symptoms shows up, once the immunity is low, you get the AIDS. So I hope that part is clear. But so if there are any more doubts, you could just shoot in, and we'll be
Yes,
taking it.
one. I think Mohit has asked, what is dental dam?
Okay, so dental dams, as I previously said, it's a barrier method. So let's say normally it would not be affecting as much, but in case let's say the the inner layer of the mouth is kind of abrased, or what do I say, it's injured. In a way, if the person is infected, it can just go through the injured mucous area and then multiply there. So that's why we use dental dams. I hope that clears it out.
And there is one comment from Parth, maybe holding the man is the same kind. Yes, so there is this movie, Holding the Man. It's a beautiful movie. It's a love story between two guys, and it's about HIV. One of the guys is infected with HIV/AIDS. So if you've not watched that movie, do watch it. It's a beautiful movie. It's about the same concept.
So one of the question which Rahul Mukherjee has asked is, earlier saliva was considered a fluid, body fluid responsible for HIV transmission. So basically, the viral, see, it is a way, I would not say it's not, but the thing is, the viral load is very less or negligible. So in a way, it does not, when you compare it with blood, or when you compare it with, CSF, it is not much of importance when you get compared. So the viral load is very less in those cases. I hope that clears it out.
And I just wanted to add one more thing to that. Okay, when you talk about saliva, so we know that saliva has amylase and other proteins, and enzymes which can degrade the protein. So we know that